Assalamualaikum. We are from Group 3. We present the topic Glove Dermatitis, Latex Allergy and PPE for Hospital Staff. My name is Nur Azza binti Muhammad Idris, metric number 1910340, and I will present about latex allergy. Latex allergy is a reaction to certain proteins found in latex rubber. The prevalence of latex allergy among healthcare workers is 9.7%. It can be caused by direct contact, for example by wearing latex glove, and inhalation of latex particle. For the symptom, for immediate reaction, the symptoms are skin redness, rash, hive, and itching, while for the severe reaction, the symptoms are difficulty breathing and anaphylactic shock. For the management, for severe reaction, we can prepare an EpiPen, while for anaphylactic shock, we can get injection of adrenaline, go to the emergency room, get oxygen and corticosteroid, while for less severe reaction, we can get antihistamine. For the prevention, the best method to prevent latex allergy is by avoiding latex product. Next, recognize the symptoms of latex allergy and wear non-latex gloves.
In response to contact with latex, there are other types of reactions that can occur. First, there is irritant contact dermatitis. This condition is not an allergy reaction, but is the development of dry, itchy, and irritated areas around the area of contact, which in this case happen while wearing the glove, from the tip of the fingers to the wrist. This condition is usually caused by contact between skin with the powder on the gloves. Next is allergic contact dermatitis. Symptoms of these conditions include rashes which will appear 24 to 48 hours after the contact and can turn into oozing skin blisters which have similar appearance to those caused by poison ivy. And this condition is caused by the exposure to chemicals added during harvesting, processing, or manufacturing of latex. There are several management steps that can be done focusing to prevent these conditions from happening. Ultimately, there must be non-latex gloves or powder-free latex gloves available in the hospital. Next, usage of oil-based hand creams or lotions is not allowed before wearing gloves to prevent glove deterioration. Work areas need to be free from latex dust through frequent cleaning. And lastly, we need to make sure that the workplace has a good ventilation system.
Okay, moving on to PPE, which is also known as personal protective equipment. So healthcare workers usually wear PPE in order to protect themselves from healthcare-associated pathogens. So let's look at Level 1 PPE. Level 1 PPE is only applicable for healthcare workers in low-risk areas where they are only required to wear surgical face mask, goggles or face shield for eye protection, as well as an apron. Okay, so let's look at Level 2 PPE.
So now I will move on to PPE Level 2. For PPE Level 2, for your information, it usually takes place in areas with bathroom where healthcare workers can bath after their duty. So this is how PPE for Level 2 looks. To protect themselves from infection, the health worker should wear at least 4 items. The first one is disposable eye protection, such as a cap with goggles or a face shield. Second, a heat-resistant mask such as N95 mask. Yes, the mask is very important. The third item is this disposable glove, and the final item is a disposable protective gown. That's it. Simple, right? So next, I will pass to Sister Shahida to explain about PPE Level 3.
Okay, now I'll proceed with PPE Level 3. PPE Level 3 is necessary when healthcare workers need to assist mechanically ventilated patients. The equipment for Level 3 is quite similar with Level 2. The difference is that Level 3 has a scrub suit, or also known as long sleeve fleet repellent disposable gown, double glove, as well as dedicated shoe or boots. Okay, now I'll show you guys the video of PPE Level 3 demonstrated by Sister Shakira during last hospital visit. Okay, last but not least, this picture illustrates the difference between 3 levels of PPE. Okay, that's all from our group. Thank you.